conversation this evening. I'm really pleased that tonight we have Meggie Pina. Did I pronounce that correctly? Okay, I'm used to the nya sometimes over the end, but Meggie Pina, who is from Alliance on Aging, and we're really going to focus on some of the work that the Alliance on Aging is doing to help the elders in our community have fewer negative impacts as the COVID-19 pandemic is going on, in addition to everything else that they're always doing. So Meggie, I'm just gonna go ahead and turn it over to you. Actually, I'm gonna remind our participants that as Meggie is talking, feel free to enter any questions or comments you may have in the chat or in the Q&A feature, and we will ask her those questions as we go along or at the end of the presentation. So really look forward to your comments and questions. So, all right, Meggie, take it away.
Thank you for having me tonight, Supervisor Parker. I'm going to go ahead and share my screen so folks can see the content. And I'll be talking about the different programs that we offer at the Alliance on Aging. And hopefully you'll be able to share this information with your community members and your loved ones. Can folks see my screen here? Great. So the Alliance on Aging was established in 1970. We're celebrating our 50th anniversary this year of being a volunteer-driven organization. It began with a small group of concerned local citizens that wanted to help seniors remain in their own homes. So all of our services are provided at no cost to the community, and we do this through various funding sources and grants. And so tonight I'm going to be talking about the different programs that are listed here, and then I'll be talking about some educational opportunities we have in October around emergency preparedness. So we have an office in Salinas and Monterey, but because of COVID, our Monterey office at Schultz Park is closed. And so our main office is on Main Street in Salinas. And we're currently closed to the public because we're not seeing clients in the office. So we're doing everything via appointment. Again, this is just out of an abundance of caution to help protect the staff and the community members. We're getting, well-versed in Zoom like many of you. So, please know that we are just a phone call away or an email. So benefits checkup, Raina Gross is our benefits checkup specialist, and she can provide information to you on programs such as CalFresh, PG&E Care Program, or the Medical Baseline Program, telephone access resources and services, Medicare low income subsidy to help you pay for Part D prescription drugs. And so again, Raina visits some of the affordable housing projects in the county for seniors, and give us a call if you're looking for ways to kind of save money on your monthly bills. We also do a lot of outreach in the community, whether it's participating in health fairs, distributing information at our luncheon, or at other organizations when they're having special events. We provide our services in English and Spanish. And we realize the digital divide is complex. So, we're just trying to, if you need help learning how to use Zoom, or you need help, figuring out how to get information from the Monterey County Department of Public Health, you can reach out to Raina or Jody. Their phone numbers are listed here. We also have the Medicare Counseling Program. It's also known as HICAP. And this is where folks, and we're entering open enrollment soon, where if you're eligible for Medicare, you can meet with one of our Medicare counselors, and they can help you kind of understand where you may be able to save some money on your prescriptions, help you, change if you have questions around billing or benefits or claims. We do not sell insurance. We're just here to help you understand Medicare, which can be complicated and complex at times. And again, all of our programs, there's volunteers that go through intensive training. and they help deliver the services. So if you're ever interested in becoming a Medicare counselor, you can reach out to our agency. As I mentioned in the first slide, we have over 200 volunteers that help us deliver these services to the community. I manage the long-term care Ombudsman Program, and that's a photo of our team at our holiday party 2 years ago. And our ombudsman, we make unannounced visits to skilled nursing and assisted living facilities. COVID-19 has really changed all of that for us. We are getting tested regularly, and we are doing outdoor visits. And so if you have questions about resident rights, if you have concerns about your loved one's care in a long-term care facility, if you're trying to get in to visit your family members and the facilities are not permitting it, please reach out so we can give you information and resources so that you can have access to your loved one and you can get your concerns addressed. We're doing an arts and crafts supply drive. We also had a record and CD drive, which was overwhelmingly successful, thanks to the Monterey County Weekly for kind of sharing that. And so I meet monthly with the activity directors in the county, and I'd ask them, what's on your wish list? And so we are collecting donations for canvases and paints, adult coloring books, fine tip markers, scrapbook paper. There's a big need for bird houses. We did get about 40 pounds of bird seed, so we're good on that. So if you're interested in making a donation, whether it's financial or actually purchasing the supplies, you can please reach out to me and we can coordinate how to make that possible. We also have a senior peer counseling program. And so our peer counselors, they receive training so that they can provide emotional support and guidance to people who are over the age of 55. Oftentimes our clients have lost a spouse, or they're dealing with the stress of an illness, or just the isolation that many of us, especially older adults, are experiencing right now. So we offer individual counseling, support groups, community education, and mental health referrals. Again, these services are provided in English and Spanish. And so you can reach out to Nan Huffling, who coordinates that program, or if you have Spanish-speaking clients, Erica Alvarez is the person you'll reach out to there for that one. Tax counseling. So tax season, it was pretty complicated this year. It was extended. So we have tax counselors that provide assistance with handling a basic tax return. So to be eligible, you have to be over 68 years old, or if you were blind or disabled, have low to moderate income. So this is, pretty basic tax return, no cost tax filing assistance. And so these tax counselors, they help you file your tax return and get your rebates. Transportation program is a fairly new program. And so this program helps educate the community on how to access the local transportation options, whether that's through MST, ITN, getting familiar with Lyft. We also provide taxi vouchers to folks. Again, everything is by appointment only, so give Alicia a call and she can help you schedule an appointment and get those resources that you need. We have a thrift store. Many people don't know that, but we have a thrift store in Pacific Grove. So if you are looking for some retail therapy, I encourage you to visit the thrift store, or if you're looking to make donations, you can give them a call over there and they can take those donations. This is a little new. In the past, we had a luncheon that happened in person. And so now we're trying a drive-through luncheon. And so the dates here, the next one is actually tomorrow. And VNA will be offering flu shots during that drive-through luncheon. And so it's really important to make reservations the week before so that we can make sure we order enough box lunches for folks. There's a request for a $10 donation, but again, it's all based on what you can do. And so you can call this number here on this page and reserve your spot for the November 10th lunch, drive-through luncheon, or the December 1st. We also we have two main fundraisers a year, and these are our trash-in shows. And so they're fashion shows where the artists make designs out of trash. And so if you've never been to our event, we have one in King City that's usually in February, and then one that is in September in Salinas. And so in order to, keep the shelter in place and intact, we're doing a virtual trash-in show. And so some of our artists have made masks. And so again, this is a fundraiser. So the request is to purchase tickets to get access to the link. And, I hope you can feel inspired and excited by what you see there. We've distributed over 3,000 masks since the beginning of April, and we've been able to do this thanks to donations from the Blue Zones Project, the National Charity League, Mask Makers in Monterey County, the Superhero Mask Project, Seaside Mask Makers, and Carmel Medical Supply. So if you need a mask, please reach out to us. We're going to continue to distribute them until we don't have any more. If you are a sewer and you want to make a mask donation, we also welcome those as well. They've been distributed to many of our assisted living, skilled nursing facility residents, our volunteers. Again, any client that calls our office asking for a mask, we will send one out in the mail to you. I'm hosting emergency preparedness workshops thanks to a grant from the Community Emergency Response Volunteers, otherwise known as SERVE. And so there's going to be a workshop on October 8th and October 22nd where we cover the basics. So we'll talk about how to stay informed during an emergency, the difference between sheltering in place, evacuating, and going to a mass shelter. You will receive emergency communication plan templates, and we'll talk about some important emergency supplies to have in your kit. And so participants who complete the workshop will receive a backup battery that they can use to charge their cell phones. And so we ask that you call and register so that we can get your email and mailing address so that we can send out the handouts to you if you need them, and so I can mail out the battery. And so the Zoom ID info is on there. You'll have to enter the passcode, and there's also the dial-in option. So again, the basics will happen on the 8th and the 22nd from 10 to 11:30. And then we're doing a fire safety, PG&E public safety power shutoff preparedness workshop on the 15th or the 29th. So you have two different opportunities to participate with that. We'll have firefighter Ben Flores from the Seaside Fire Department on the Zoom with us. And so we'll talk about some just basic home fire safety techniques, ways to prevent an emergency in your home, a little bit about CAL FIRE's Ready, Set, Go program. I'll give you information on air quality apps that you can download on your phone so you can kind of keep your lungs safe with all the smoke and the fires that are affecting our communities and our state. And then we'll talk about the PG&E public safety power shutoffs and how to develop a multi-day plan for having no power. And participants who complete the fire safety workshop will receive a headlamp and then a glow stick that has a whistle. So again, you can call our office and register to participate in either one of these workshops. And it's been a pleasure to offer them in September. And I'm grateful for SERVE support because it's been, as we all know, with the Carmel and the river fires, now is the time to really prepare as we continue to be in fire season. And lastly, this is our team photo from our holiday party last year. We like to dress up, and I appreciate working for a multi-generational organization. We have staff who are in their 70s and 80s who have been providing services to the community for over a decade. And, we're here. Visit our website for information on COVID testing, evacuation sites, all of the programs and offerings I have mentioned today. And then you have our phone number here. I see there's a few questions in chat, so I'm wondering how we want to handle that.
Great. Yeah, I'll just kind of try to keep an eye on those, and I'll ask them. I thought about interrupting you, and then I thought, no, I'll just we'll do it as once the presentation is complete. Yeah, so the first question is about Medicare. When do the high cap counselors help a person do kind of a self-assessment for Medi-Cal, Medicaid, if that might be needed in addition to Medicare?
No, you would need to reach out to the Monterey County Medi-Cal office for enrollment with Medi-Cal if you have those specific questions. Because again, that's a little bit a different type of insurance. So the high cap counselors just focus on Medicare.
Okay, so if someone thinks they might qualify for Medi-Cal, they would go through the Department of Social Services like everyone else. Okay,
Correct.
thank you. Then a question about flu shots, where you're offering those. Are they the type that are designed for seniors? This question says the stronger type. So I don't know actually if the flu shots for seniors are stronger or less strong.
I think there's an option, and this would be, when you call. I don't know that you'll be able to get in tomorrow because that's the flu shot, but I'm pretty sure there's an option to pick like the higher dose or the lower dose, basically. So when you say stronger, it's just a higher dose. So I'm pretty sure they are offering those two different options for folks.
Great. And so it is recommended that senior higher dose?
I mean, I think definitely you need to talk to your doctor about that based on what your medical needs are. Another thing to keep in mind, and from what I'm learning, is that when a vaccine for COVID comes out, it's not recommended that you take them at the same time as the flu shot. Mm-hmm. So if you can get the flu shot earlier, it'll give you a little bit more options when a vaccine is available.
Great. That's a good idea. Do you, let's see, so someone had a question about whether you welcome guest speakers for any of the upcoming Zoom meetings. Wendy, it looks like Wendy's responded to that to say, if you've got ideas, let us know and we'll, oh, I see. So I was thinking the person was asking about Alliance on Aging Zoom meetings. And I think Wendy's responded as if it's this meeting. So how about for the Zoom meetings that the Alliance on Aging hosts, are you looking for guest speakers on topics that might be of interest to seniors?
I'm always interested in collaboration and partnership. I feel like the emergency preparedness workshops that we have scheduled, we're good on speakers, but we do provide monthly trainings to all of our volunteers. Mm-hmm. And we also provide other, educational opportunities for the community. So if you have something that you're interested in presenting on or resources to share, please reach out. We're happy to help distribute that information and just build more collaboration.
Great.
I'm going to go ahead and stop sharing my screen and share my email in the chat, it looks like.
Yeah, so the question was whether there is an email address. There's a phone number here, but is there an email if someone wanted to contact the Alliance with some ideas for topics to present to seniors?
I will put my email in there for now, and I'll also I'll include Jody's email. She's kind of our admin in the front end of our office.
Great, great. Good. So now there's a question coming that I was just going to ask. One of the challenges that I have heard about, and I know a lot of us are feeling, but I think it's especially true maybe for seniors, especially those who live alone. What kinds of activities and efforts have you been undertaking at the Alliance to help with the isolation that some CA have been especially feeling during this shelter in place?
Sure. So, you know, at least in the Ombudsman program, and initially we called all of our volunteers to do a kind of a check-in with them to see what they needed. And that's where I kind of found out that there was a need for masks. And that's how that kind of got started and birthed up. I would say the senior peer counseling program is a good resource for isolation. You know, whether it's getting referrals to behavioral health or mental health. We did a Cards for Humanity drive where we collected cards for isolated folks in nursing homes and assisted living. We actually ended up receiving over 5,000 cards. And so we were able to send those out to some of our low-income seniors and also all of our, 2,846 long-term care residents. I'm going to stop sharing my screen. And yeah, I think it's something we're going to have to really address, especially with a lot of our senior centers being closed. And I think it's also bridging that digital divide where folks they don't have a computer, they're intimidated by Zoom, and helping them get better access to some of these programs.
Yeah, I was going to ask you about the lunch, the monthly lunches, and whether those were still happening. And so you mentioned that it's now a drive-through. And the other question I had on the peer counseling is, it was mentioned that, of course, there are individual counseling sessions available and then also support groups. So what has been the way to transition that into a safe way of getting counseling during the shelter-in-place time?
Yeah, I think Nan has been, meeting with the volunteers and seeing how safe they're feeling, whether they're doing socially distanced sessions outside or whether they're doing primarily phone. Older adults are the most vulnerable population to COVID, so we're just trying to be very sensitive and cautious of how we're providing services.
Do you have a list of seniors who have accessed your services that you have your volunteers calling, for instance, to check in on them or to help them with ideas about how to not feel too isolated around this time?
Yeah, so I know any of our clients who are receiving peer counseling, they've had check-in calls. Some of our ombudsmen, while we were unable to enter facilities, we did resident check-in calls. I also know Covia Well Connected has a lot of resources there in terms of calling in. And I think that's kind of where we're heading, are these more phone calls, and I think people really need to build a support system around them. So Covia would probably be another great resource to find out about those check-in calls. We're not necessarily calling the general public, but definitely our clients, they've been reaching out to us. We found in the beginning, many of them didn't even know that there was a shelter-in-place order because they weren't, linked into social media, or they weren't familiar with the county website. And so sometimes it's just getting that information to these folks in a way that they can use.
And are you finding that people, well, it probably varies, but what kind of percentage of your client base is comfortable with Zoom, and how, what approximate percentage really prefers the phone? In terms of being able to access some of these programs?
I think it depends on the program. I know that most of our Spanish-speaking peer counselors have not been using Zoom because they're not familiar with it or they don't have laptops. Our ombudsmen are meeting monthly via Zoom. It's very complicated when we're trying to access the residents in long-term care facilities via Zoom. We received a grant from the Community Foundation, and we purchased iPads for all of the skilled nursing facilities so that we can have access to the residents. But something I've heard from some of the activity directors is that residents don't actually like using Zoom. They're confused by it, especially when you have folks that have dementia or some type of, memory. They don't realize it's live, or they're just not getting nourished that same way through the digital connecting. So I think, I have sat down with people and kind of, walked them through Zoom, and it definitely, takes time. I think that's probably a good service to the community, is how do we figure out how to teach, the older folks how to use these technologies.
And yet if people are more comfortable with just a phone call, then maybe that's the way, I mean, when we get used to Zoom, we think it's so great. And FaceTime and Skype and all those things. And yet for some people, it's just weird. And they're used to, the phone to the ear and imagining the person on the other end. And, so if that's the way they're comfortable, then, that's probably okay too. I have a question about the whole thing of being able to visit a family member who is in a skilled nursing facility or long-term care. Can you talk about what is allowed and what isn't, and what you're able to help people do in terms of being able to have visits with their family members?
Sure. So the skilled nursing facilities are regulated by the California Department of Public Health and from CMS, which is the federal component. And then assisted living, they're regulated through community care licensing. So both community care licensing and CDPH have issued guidance to facilities regarding visitation. So they've told the facilities that they need to start providing outdoor visitation, indoor visitation, especially around compassionate care, because what we're seeing is a lot of older adults are not necessarily dying of COVID, but they're declining very rapidly because of the isolation they're experiencing. And when we say declining, it means they're losing weight. They're not eating, or they're not healing from an infection. And so it's been a little bit of a struggle, and I understand where the facilities are trying to keep the residents safe, because we do have, numerous facilities in the county that have COVID positive cases right now. And part of that is because in skilled nursing facilities, they're testing the staff weekly. So it's, they're doing a lot of surveillance testing. And so the numbers are fairly low because of that surveillance testing. But this is something all the facilities need to be working towards, providing at least outdoor visitation. But the weather's going to start changing. And so with the smoke, outdoor visitation gets very complex. So I think it's just about, if you're wanting to access your loved ones and the facility's telling you no, then you need to call our office, and we need to kind of have a discussion about why they're saying that and how to remove some of those barriers. Whether it's, they're supposed to designate an area in the facility where visitation can take place. So you may not be able to visit your loved one in their room, but they're supposed to, like I said, designate an area, sanitize that area. And so again, CDPH and CCL have issued guidance in writing. And so I think the start is just reading that guidance. And it's a lot of jargon, and it can be confusing, but at least if you read that guidance, you understand what the regulatory entities are saying. And as I mentioned, if you're still hitting roadblocks, let's talk and figure out, well, what's actually preventing the visitation.
Yeah, I think that is really helpful, because we don't necessarily know how hard to push, or what questions to ask anyway, so that's really helpful. And I did read somewhere that that isolation is as hazardous to seniors' health as smoking 15 cigarettes a day. It's like, so when you say that people decline rapidly when they aren't getting visited, yeah, wow, it's if that's kind of the parallel, really very concerning.
Mhm.
So so a comment here, just in general, not necessarily people in long-term care, but this person's also worried about grandparents not being able to hug and see grandchildren. There's because of the even with some allowance for families to be able to designate kind of social bubbles or their circle, that it can be really hard because the kids may be being exposed more broadly than really keeping it safe allows for. So yeah, it's a really challenging time that so many kids are missing out on their grandparents and the grandparents are missing out on the kids. It's really really a challenge. And so another question that's here is, do you have any about ways that the general public, the community can help with any of these things, like writing cards or sending pictures or anything that can help alleviate some of the isolation and the kind of low spirits that go along with that?
Absolutely. I mean, we're still collecting cards. So as they come in, I've distributed them to all the facilities, but if I keep getting them in, I will send them out to some of the positive facilities that do have COVID cases. So, you're still welcome to send cards in to our office. I had mentioned the arts and crafts supplies. I think that's a good way to kind of get connected. If you want to become a volunteer ombudsman, that's a little bit a struggle we're having right now is, I have a team of 21 volunteers who for the past 15 years have been making monthly visits to facilities, but many of them are older and they're not willing or able to go into the facilities. So if you're interested in becoming an ombudsman, we're going to be hiring in a few months because Sandy's retiring, but you need to get tested every week and be willing to go into these facilities. So that's another way to kind of get involved. Or as I mentioned, if you're not interested in the Ombudsman program, becoming a peer counselor, becoming a high cap counselor, and just kind of realizing the risk, the exposure inside that, but also just the need.
Yeah, those are helpful suggestions. If someone wants to send a card, so I'm trying to figure out exactly how this works. Would I just send a card, like not addressed to anybody in particular, but just saying, I'm out here, I'm thinking of you. I mean, what from a practical standpoint, what?
Yeah,
When
when we did the Cards for Humanity campaign, I had asked people to just send me 10 cards. And this can just be written on a white piece of computer paper. It doesn't have to be an expense. Some people had their kids draw pictures, and we had just said you can just address them like, dear neighbor, or dear friend or dear senior. And some people painted, there were beautiful watercolors people sent in. Some people put stickers on there and just said, I'm thinking of you, we're all in this together. Here's what I've been doing for my sanity. I found that it was pretty therapeutic for the card makers. And, it's okay to be general. You could put it, some people put quotes, they included pictures of their animals, their pets. And so it was just, they could either send, the cards in an envelope or out, not in an envelope. And they could package them together and just send them to our main office. That's how we were collecting them.
That's great. It sounds like a lovely thing to receive as well as to create. That's neat. Could you talk a little bit about where the Alliance on Aging gets its funding and whether there are opportunities for community members to also donate funds to the Alliance on Aging, just to make sure that seniors who need these services and this outreach are getting.
Absolutely. We take donations. There's a PayPal link on our website. You can send in a check donation. I feel really proud that we do offer our services at no cost, that we're able to do that for folks. Primarily, our funding comes through the AAA. So the Area Agency on Aging, they receive money from the California Department of Aging. And so that funds several of our, our HICAP program, our Ombudsman program, our outreach and benefits checkup. We were also receiving money from the city of Monterey. We are no longer receiving funding from the city of Salinas. So that's shifted a little bit. We also have different grants, as I mentioned, the Monterey County Community Foundation, serve. We have, and some of the slides that had pictures of logos of the different programs that were funded through the transportation program. And so oftentimes these were measures that were on ballots and that would fund these different programs. Monterey County Behavioral Health helps with the peer counseling and with some of our Spanish speaking services. So it definitely takes a village, and we are always looking for more financial support, especially during this COVID time. We're just having to get everybody to be able to work remotely. So getting laptops, iPads, things like that can help us really stay connected to folks. Also, just the amount of PPE we're needing. As an ombudsman, I have to have a face shield sometimes, or an N95, or a surgical mask, and lots of hand sanitizer. And so that's just an added expense on top of everything.
Mm-hmm. Yeah, that makes sense. Let's see, I had another question. Funding, services. Oh, I wanted to ask, how able are you to meet the needs of the Spanish-speaking population with volunteers? Do you have a kind of a continuous need for people who are fluent in Spanish, or is that need pretty well filled?
I think we're always looking for more bilingual volunteers. All of our services are provided in Spanish, so every program either has a staff member who can provide that service in Spanish or volunteers. So again, we're always looking for bilingual folks.
That's great. Yeah, it's just having this focus on seniors. It's not everyone who wants to volunteer to work with this population. So it's, like anything, people have their preferences, and so it's really, but you've got such a neat variety of opportunities to serve. It's really, it's great. And I wanted to mention that I'm going to be retiring soon. And so I started looking at, I don't need to sign up for Medicare in this enrollment period because I will have the ability for a special enrollment period, more tailored to when I start needing the benefits. And as I was reading through the manual and trying to think about, well, what am I going to need and how do I do this? I thought, wow, where's HICAP? And I called, and I've got an appointment set up to have someone make sure that I'm, not missing anything, because it does feel like a lot of information to have to process, and it's, can be a little daunting to get, just to have the assurance that I'm looking at everything, that I have reliable information, that I'm not talking to somebody who's trying to sell me something. It's kind of nerve-wracking. So I had known about the HICAP program for years. You hear about it when you're paying attention to these things. And I always thought, okay, I'm going to remember this for when I need Medicare, because I bet I'm going to need help. So it's really
Yeah, and it's
fantastic.
also something to call, like people will every year during open enrollment call because their medications change. And there may be a way to save some money on your medication, on your Part D plan. And yeah, I think navigating insurance is so complicated, especially with long-term care. You know, assisted living is all private pay. So Medicare is not paying for assisted living. And Medicare will only pay for 100 days at most in a skilled nursing facility. After 100 days, you're either private pay or you're transitioning to Medi-Cal. And that can be, private pay can be anywhere between, excuse me, like $6,000 to $9,000 a month. So it's, again, I think it's the more we can feel empowered and get that information, the less we can kind of be surprised or disappointed when we think, oh, I have Medicare, I'm covered. You know, it's understanding, okay, well, what does my policy cover? What do I need to prepare for?
And there are so many permutations depending on your own individual case. And there is a lot of information that's available, but you know, when it's like, but how does that work if this, and to be able to really get those kinds of answers is super helpful. And that's great. I love it that you've got regulars, you know, who come back each year for the open enrollment period, because yeah, there are rules and regulations that change. There are changes in the formularies. There are all kinds of things. And boy, from the information I could see, figuring out Part D and what is covered and what do you do if it says it's not covered, and can you make an exception, and boy, I mean, it's really, it's hard. It's sort of like that same question of, if you want to visit a loved one in a skilled nursing facility, how do you know how hard to push, what questions to ask, where the opportunities are for some exceptions, or to find a way around it, or whatever, all those things. It's really great that you've got people available for that kind of specialized empowerment. It really is great. Have you found with COVID-19 anything surprising about what services people seem to want more of or not, or has it been fairly not predictable, but kind of expected, how what people seem to be needing and wanting from the Alliance?
I mean, I think in the beginning it was just, it just felt so chaotic. You know, I think there was a lot of fear, and then a lot of older adults did not have the information that they needed to stay informed and really understand how to get tested or what the risks were. Or we had folks coming to the office that weren't wearing masks, you know, and having to educate the community on that. And we did notice in the beginning, we were getting some calls around like domestic abuse, and like they were needing resources because they were experiencing domestic abuse. We're still getting calls from people that are having rent issues. You know, they can't afford their rent, or they're trying to figure out ways to save money so that they can pay for their medications, or they can pay for their food. Food delivery was a main issue. So we kind of called all of the grocery stores in the county. We were asking them about senior shopping hours, because we all know how, you know, intense the lines got in the beginning. And so I think it's just educating the community on what resources are available. And if we don't have the answer for you, or if our volunteers don't have the answer, I know that everyone is committed to finding that information out for you. You know, we're here to support, and we're here to, you know, make our older community stronger. We're all aging, really, you know.
Yep, we're all doing it.
Yeah.
Yeah, and you know, I just really appreciate what you just said about that. you as staff or the volunteers would call the grocery stores to find out what their hours were and what availability of delivery and all that kind of thing. Doing that work on behalf of the callers, even before they call, is so important, because when your life is turned upside down, as it was with the virus, a lot of times you don't have the energy to just make call after call after call to find out what's going on. So the fact that you all did that, I really, it's the kind of thoughtfulness that I really appreciate, that that non do. So
Thank you. Yeah, I think it's finding out what the need is and then realizing that the community is there to support that need.
yeah.
And it's just, that's why, like I'm saying, just we have to be adaptable and flexible, because the needs keep changing. And we were just kind of following the lead of our community and what they were saying they needed.
And Wendy has put in the chat that the Great Plates program is still accepting people to be part of that program. So, and people can access that through the 211 phone thing. So that's really great. The other thing I wanted to mention is I noticed on your like the fire safety and the power shutoffs and that you were, and emergency preparedness in general. Two things about that. One is I'm just appreciating that, yeah, with the fires happening now, people will be to know what to do. And just like with the virus and COVID, you can't think that just because something is happening that everybody is going to know where to find the information or will know what's going on. The fact that you're really making this available, I think is, it will be on people's minds. So this is a really good time. And then I noticed that one of the things that you do is you encourage people to get signed up on the alert system, the reverse 911 or whatever it is called. And that's something that I would think particularly would be valuable. It's valuable for all of us, but especially for seniors to be able to get that information, prompt way about if there's something happening that they need to know about to keep themselves safe.
Yeah, I think emergency preparedness can feel very daunting, and we kind of get stuck, and I think it's just making those small steps, like writing down those important phone numbers, figuring out where you would go if you have to evacuate. We know that our, folks at Rippling River had to be evacuated, and that was very complex. You've got folks that use wheelchairs and have caregivers, and kind of understanding what your options are and realizing that having a plan means that you're safer and you have better outcomes.
Right, because trying to do that kind of strategic and logistical thinking when there's a fire breathing down your neck or there's an earthquake going on and things are falling down all around you, that's not when we do our best thinking, usually. It's very reactive, and some things we do may be good, but if you've got a plan, then you can really be more assured that you're going to get what you need. So yeah. Let's see. So we have about eight more minutes. So let's see. Is there anything else that you want to be sure that people are aware of? Maybe just talking a little bit more about volunteer opportunities where the needs particularly are.
Sure. I'm definitely having a need within the Ombudsman Program. And so that training is a 36-hour-long training, and that'll be done most likely via Zoom. There'll be some in person, especially the donning and the taking on and taking off of the PPE. I'm pretty sure HiCap is not going to have a training because they're entering open enrollment season right now. So they're, but I'm sure that they will probably have another training because things are really shifting, for our volunteers and for our programs. We're going to need more funding because we can't necessarily meet the needs relying on the way the volunteer opportunities are shifting. Just because our older volunteers, they want to stay safe and they don't want to expose themselves. If they're not hugging their grandkids, they're less likely to, volunteer to be out in the community. And we have, most of our volunteers are still very engaged. I know senior peer counseling, I'm sure they're always looking for volunteers, and we just provide ongoing training. And so we just try to empower people to feel like they feel confident in providing the services and that they have the support necessary. For the Ombudsman program, you have to pass a background check. And that's part of just keeping our vulnerable population safe because you are having direct contact with them. And yeah, I think I put my email in the chat, so if anyone has more specific questions around volunteering or how they can get involved.
Great. And maybe if you would put up the website, the Alliance on Aging website, and just kind of show people where things are and how to, where they can find the volunteer opportunities. There's really such a comprehensive listing of the programs and services, where if they want to make a donation, they'll find that information. So,
sure. Would you like me to share my screen again to kind of show that?
yes, that's what I was thinking. Just give people a really easy.
Okay, give me a moment here to pull it up. Okay. Can folks see my screen here?
Yes.
Okay, so this is our homepage. And so most of the most helpful information is going to be all on this page here. And so you've got some of our upcoming events. We've got information on testing sites for COVID. We've got our hot topics here tonight, luncheon information. So this homepage, you just keep scrolling down and you can get more information about the flu clinics. Again, via the testing options. So our homepage has, most of the helpful information that you'll find. I also just want to bring everyone's attention to the contact us page here, the tab here on the left. So if you hit that, that's all of our contact information. You've got the program managers information, their direct lines. You can call and leave us a message. We'll call you back. So that's probably another good page if you're interested in learning about a specific program, whether it's transportation, outreach. We got resources tab. So again, just more resources again in English and Spanish. Our website's also available in Spanish. So if you go to the top right up here, there's an Espanol button. And so that translates everything into Spanish. And so there's that option there for folks. I'm going to go back to English. And so there's also,
and there's the volunteer. So you can, across the top, you've got the programs, the volunteer, with current communities.
The programs tab, you can click on each individual tab and learn more about the different programs that we have here. So I'm just going to click on the Ombudsman. So there's some more information there. Again, Medicare. We've got some videos of what the services look like before COVID. Now everything again is done via phone. The donate button here on the left. We acknowledge, our people that have been supporting us, people that asked, different ways to give. Any more questions on the website?
No, I think it looks like it's pretty straightforward and easy to navigate, and definitely makes it easy for people to see where they might volunteer. One of the things that I really appreciate about the Alliance on Aging is that you do have so many seniors who are doing, peer outreach and provision of services, but it also sounds like you may be really welcoming even more than usual people who are not yet seniors.
Absolutely. I mean, there's no, for some of the programs, you have to be at least 18 years of age, but there's no age limit, and that's something, when I think about what it means to grow older, I have a large variety of examples of very active and engaged older adults and what it means to be engaged as we get older, and staying connected and informed. I think that's probably one of the main benefits of being a volunteer with our agency is you kind of are linked into that kind of support network and that information. And we're really just there to help one another navigate these really big challenges that come our way as we get older.
And staying active and involved is good for our health. So sort of the opposite of smoking 15 cigarettes a day, and isolation. So it's a positive feedback loop, being involved and staying involved. And we've got comment here from Jenny. I love Spirals in downtown Pacific Grove, the thrift shop. They always have great stuff, supporting a nonprofit and the environment by keeping things out of the landfill. Yeah, that's great. Well, I really appreciate you being here, Meggie, and talking about, it's just a lot of services that the Alliance on Aging provides, and both to the clients, but also the volunteers. I mean, everybody benefits. So, and I think especially in this time of the virus and the pandemic and the shelter in place, the need for people reaching out to each other and making sure that that we're okay mentally, physically, it's more important than ever. So do you want to just do you have anything you want to say to wrap things up?
I just encourage, anyone listening, whether it's via the Facebook Live or with us now, it's just, think about who's the oldest person that you talk to any given week, and maybe expand that a little bit, because I think we're really relying on one another to get through these, whether it's the, natural disasters and emergencies or health crises, and reach out to that neighbor next door that maybe you see walking around with their walker or sitting outside, and just support one another. I think that's going to help us really get through this.
Thank you. That's a beautiful thought, and it is so doable. Just walk next door or say hi. It's really something that we all can do. So thank you so much for all the work that the Alliance on Aging is doing, and thanks for letting us know about some of it. And I do encourage all of our participants on Zoom and the Facebook Live audience, definitely check out the Alliance on Aging website and look for opportunities to volunteer. There are some really rewarding opportunities for you and for any of the elders that you may interact with. And I want to invite people to come back next week for another episode of Hot Topics. I don't remember who our guest is next week, but you can come tune in and find out, and we will be sending out an email reminder. I'm getting a prompt. It's going to be our Human Resources Department from the county they've been doing phenomenal work to really support our workforce and make sure that particularly parents with children have the support and the options that they need to take care of themselves and their families. So that'll be a really interesting case study for us. Thank you again, everyone, for participating. Thank you for your questions and comments. And I invite you back next week. And in the meantime, be safe, be well, and be kind.